As a sports medicine specialist, I primarily deal with knee and shoulder problems. Really the whole spectrum, both young, active adults, and even elderly. But one common thing that we see, particularly with the advent of the organized sports as kids get back to school, are problems with the kneecap, or what we call patellar instability. The kneecap, or the patella, is the small bone in the front part of the thigh and the front of the knee joint. It's actually attached within the quadriceps muscle or extensor mechanism. The kneecap functions to help magnify the force of your knee extension. It actually, for all the engineers in the crowd, works somewhat as a pulley because it elevates the force of the quadricep muscle and increases it by about 20%. Now, there's a great deal of variability between people and their kneecap stability. Kneecap stability is a very wide spectrum. Some people are very loose jointed, some people are very tight jointed. And in addition, you add injuries to the kneecap in the mix, and you can have a lot of pathology going on in the very front part of the knee. The kneecap is a very dynamic structure. It's attached through muscles superiorly and through the patellar tendon inferiorly. People can have some degree of looseness of the kneecap, which is relatively normal. Now, if the kneecap becomes too loose, it can actually pop in and out of the joint, and that can be very debilitating in both young and old people. Sometimes it can occur just through genetics and in general loose jointedness, or what we call hyperelasticity, but sometimes it will occur after an injury, some type of twisting injury to the knee, which has caused the kneecap to pop out of joint. The vast majority of kneecap problems, though, are best treated without surgery. As a surgeon, I come in when these things have failed or people have significant acute injuries and have significant what we call malalignment of the kneecap. Most kneecap problems, though, as I said, are best treated with physical therapy. We try to improve the health of the knee. Flexibility is very, very important, particularly of your hamstrings and of your quadriceps muscles. The other thing that we really love patients to work on in physical therapy is what we call Patella femoral mobilizations. In other words, we try to get the kneecap balanced well, both medially and laterally, so the kneecap is not too tight or too loose in any one of these directions.